healthcare, the doctors and the nurses and the medical staff. Health is wealth. How can we do what we do without everybody like yourselves, the good people, the doctors in the medical field? We're so blessed. If I was there by myself trying to deliver this baby, I'd probably be telling her to, instead of telling her to push, I'd be telling her to pull. A couple of people I'd like to thank, my brother Adeeb and Jay. Jay, where are you at? In the back. Adeeb and Jay, if everybody, round of applause. Without them, we wouldn't be here today. My name is Ronnie Dwairy. I am the CEO of Bestway Oilfield, but today, right now, I am Dr. Adeeb Dwairy's brother. Adeeb is a better brother than I am. I mean that sincerely. He's the biggest-hearted person. As a kid, he always wanted to help people. Most 5-year-old kids want to be police officers, and then a few years later, they want to be firemen, Air Force pilots. Adeeb, from day one, knew he wanted to help people and be a doctor. And he didn't realize at the time he had to give his family free health care for the rest of their lives. But we're here for Senator Bill Cassidy. Everybody, round of applause for the Senator. In the Senator's position, he has to make tough choices. And instead of taking the easy choice, doing what's popular, he has proven in many years that he takes the hard choice and does what's right. The Senator and I, we have a lot in common. I don't know if you all know this. The biggest decision of both of our lives, we made the same big choice. Both of us are married to a girl named Laura.
But different Laura.
Thank you, Senator, for being here. He was also a physician. He still is a physician. And he chose, instead of continuing practicing, service over self. And he is now serving all of us and making these hard choices every day as our U.S. Senator. Please, round of applause. And before introducing Senator Cassidy, I'm going to ask my brother to say a few words. Thank you, guys. It is my honor to have you all. Thank you all for coming.
It's always hard to follow Ronnie. So Ronnie, thank you for inviting us into your home. It's beautiful. Just all the supporters here, we're filling up this room. It's incredible. You know, this was, I feel, kind of like God's plan. How spontaneous this got put together. Ronnie, you said it well. You know, thank you, Jay. Stuart Miller with Munchard. This was so organic how this happened. One of our partners, Dr. Nuruddin, he's here today, the global PI for Pinnacle. We were at ASLD. It was in the midst of the government shutdown, and Dr. Cassidy, and during all that turmoil, still spent the time to come to ASLD, which is our annual liver conference, and that's, to me, when it showed his passion for healthcare. You know, I oftentimes say, you know, we got to bring back the care back into healthcare, and I think that starts with us providers as healers. But what more important would that be in politics today? And he's proven that as a battle-tested, proven leader. He's showing that with his advocacy for vaccines, the HALT Act, and I'm looking forward to him winning for a third time this November. So thanks for coming.
Before I go further, Carolyn, thank you.
Oh, that's cool.
Yeah, can you give a round of applause for Lauren's up there? I have learned in my life that a husband proposes, but the wife disposes. And if the wife doesn't want to do it, boom, that's it. So thank you very much. Thank you all for being here. This actually started 14 years ago when I met Fred Zeidman. And I was running for office the first time. And then Fred said, took me in graciously. I was the congressman from Louisiana. Took me in, had a great conversation. Then he introduced me to Jay. At the time, Jay was a teenager. And now Jay is Jay. And Jay introduced me to Adeeb. And I can go around. Many of you I've met before. Many of you have been generous with my campaign before. Thank you very much for that. I'm an incredibly privileged guy. I am like, first, there is so much brain power in this room. Just conversation after conversation I was having about things which could have been a committee hearing with people testifying. And I say that because people in this room think about how to make our state and our country a better place. whichever state you live in. I was just speaking to Debbie about the Ronald McDonald House. And for those of us who are physicians, we know that when a child is sick, the parents feel so incredibly vulnerable. And you add upon that at times the family has no money, and then there's just a little bit of a beacon of hope, of a respite, a place to stay. Making this state, our country, better, a family at a time. And that's what many of you do. I wake up every day, I think, how do I make my state, Louisiana, my country, a better place? But each of you has so much to you. I feel a little bit like an evangelist. Because each of you has so much that you're blessed with. That he or she to whom much is given, much is required. And if we can just take what we have and bring it to bear in service of our country and of our state and of our fellow human being, we can make a big difference. I would like to make a difference. I am running for the third time to make a difference. And I've done a lot already. I'll just be honest. At some point, you got to brag about yourself. I was raised Episcopalian. You're not supposed to talk about yourself. You don't get elected again if you don't talk about yourself. But I've actually been able to accomplish a lot. There's just a lot more to accomplish. And so I'm running for that third term. You are helping me. I've got a little bit of a challenge. I always like how people negotiate the fact that the president and I have a history. Ronnie spoke about independence. But the president and I have had some significant disagreements in the past. We get along very well in terms of policy. In the last 3 months, he has signed 4 bills that I either wrote or negotiated. Like the Fentanyl Act, giving law enforcement more tools to fight fentanyl. The Support Act, to give communities more money to support people who are addicted or have serious mental illness. The IRS Math Act. So if you're making a little mistake on your math, the IRS doesn't come down upon you like an anvil, but rather gives you a little bit of a break. Yeah, it's not systematic, it's a break. We're going to help you out here. And then a PBM reform bill, where I was talking to Lindsay. A PBM reform bill, which attempts to squeeze a little bit of the fat. No. A little bit of the fat that PBMs put into a pharmacy bill, and instead give that back to the patient. Now, he signed that in the law, and that's one of the things that I negotiated. We get along very well. 4 weeks ago or 3 weeks ago, his staff was in my office asking for my help to write a bill to further decrease healthcare costs. And last week they were in my office talking about judges. But then 2 weeks ago he endorsed my opponent. And that's okay, because we will still win.
Yes.
We will still win. My opponent's a nice person, but has not accomplished a lot as a senator. With your help, we'll have the resources to show both what I've done and the contrast by which we think the state of Louisiana. And so far it's working. Our last poll shows my numbers up and her numbers down. And that's kind of like what you want to see. Richard's a doctor who also does hedge funds. You want my number up and the other number down. And so we're doing well on that. Thank you for my fellow gastroenterologist. I taught medical school students for 25 years. I've got lots of jokes related to that, but one of which is I'm famous for my lectures on diarrhea and hepatitis. It may be a little disgusting, but I certainly hope none of my students ever looked in the toilet bowl after a bowel movement and thought the same way about their stool as they ever had before. You know what I'm saying? Like, oh yeah, Cassidy's lecture, I now understand that. But on the other hand, if you're going to be a good physician, you got to be a little earthy, and you got to meet people where you are. And our body is part of where we are. I would love to take any questions y'all have, but I really want to thank y'all for being here. Carolyn, Adeeb, Ronnie. By the way, I'm coming here from the airport. The taxi driver says, this is the hospital district. You going to a hospital? So I get on my map and I get on there. I don't think so, but I'm not sure. It could be a hospital. You know what I'm saying? It could be a hospital. It turns out it's just an incredibly nice house. So Ronnie, thank you for that, man. Really
Thank you for
appreciate it.
coming. As busy as you are, thank you for being here.
Thank you. And I don't know, any question, one or two?
Public service message. It's colon cancer awareness month.
Colon cancer awareness month.
Anybody who needs a colonoscopy.
So, I've got a joke, and a lot of you have heard it before. Why does a gastroenterologist go into politics? For 25 years, I woke up every morning and did colonoscopies, and I got tired of the view. And I'll look around, and if somebody's less than 50, they don't get the joke. And if they're over 50 and they don't get the joke, I gotta look at them and say, this means you! You need that screening. Of course, the punchline of the joke is that you go to Washington and sometimes the view seems the same, but that's another thing. Anyone else? Yes, ma'am.
So there's a healthcare bill that's trying to break up conglomerate and corporate practices of medicine. What are your thoughts on that, and what kind of direction are we going?
I think that the way you break up, so I'm a conservative, and you want market forces to work, but you realize, as Warren Buffett says, show me the incentive, I'll show you the result, or something like that. So I think that the corporate practice of medicine typically is a little bit more expensive than the guy who's independent, the gal that's independent. You with me? And so one thing I'm really pushing hard on, and it's complicated, much more complicated than you would think, is how do you have price transparency? Meaningful price transparency. We got some of it in the No Surprises Act, which was my bill, but more even meaningful, so that mom could look on her app and see, oh my gosh, this gastroenterologist is at $1,000. I'm still in my deductible, although that might be a covered benefit. There's ancillary services, and someone goes there instead of the fellow that's $2,000. That begins to drive everybody to be a high-quality, low-cost provider. Does that make sense? So I think that you don't go and say, okay, antitrust, because that's going to be very difficult. You fight on it 20 years from now, something's different. But rather you do something kind of market-oriented that changes the incentive, and you change the incentive and something different happens. So we'll be marking up something called the Price Tag Act. I just met with my staff about it, but it's more complicated than you would think. A lot more complicated. And believe it or not, stakeholders are trying to intervene. Either to muddy the waters or to shift it to their direction. So, yeah. Ramon, where are you, man? Is Ramon still there? Oh, I had to leave? By the way, I know a little bit about some of you. Ramon was a football player and a golfer. I thought, how do you you're just smooth like that while you're hitting somebody on the floor. Once more, thank you all for being here. You are committed to our country. You are committed to making life better for our fellow Americans and for people who are not Americans but are fellow human beings. I really appreciate, I'm really honored that with the attitude that you have, that you would make the decision to come tonight. I grant out a friendship with Carolyn and Adeeb and Ronnie, of Jay, but more than that, because maybe they could say to you, Bill Cassidy shares our values. And if I share your values, I feel pretty good about my values. Thank you very much. And can I ask y'all to give it up for the musician? He's really good. Just for a sec.
So I know Bill a year or two. You what? I'm Richard Westmark. Neurosurgeon. Well, so I always describe Bill as the person who just makes our country better. And by the way, thank you. I've been in this house windows and shots. Yeah. It's a beautiful home, and thank you all. I always say that the world is just a better place because Bill is our senator. And I believe that with every bit of my heart. Campaigns take money. This campaign's going to take a little more money by its nature, because he's got serious competition. You know, in the hedge fund world, we talk about asymmetric risk, convexity. I'm going to call you convexity Cassidy, which is a really good thing. What I will say is this. My wife and I made a contribution to Bill a couple weeks ago. I don't want to put anybody on the spot at all. So you can do this very privately. Go see Olivia. Up to what we did weeks ago, I'll match anything that anybody here gives. So it's a really important cause, and I'm very happy to call you a friend, but I'm more happy to call you our senator.
Thank you.